Guys, what's going on? I'm gonna give it a minute before I officially introduce the show. See if some people come in. I don't want you to miss this information. I don't want you to. All right, all right. I'm gonna go ahead and start. You can come back and watch the beginning of the broadcast. Good evening. This is Steve Belcher. Thank you for tuning in to another edition of Kidney Disease Education Moment. So before I start talking about patients' rights, responsibilities, and facility rules, I would just like to spend a moment and talk about the situation that has happened throughout this week with June Kaufman. When we started out this week, we had no idea that this week would end with this whirlwind of um, comments and situations that we encountered since we've been on Facebook. I first would like to apologize to, I'm sorry, I would like to thank Carrie Villasana from Stevensonville, Texas, for standing up for us in a group. Carrie, I saw that post that you posted, and I really appreciate what you did. I'd like to also thank Jeffrey and Jared Brown for their ongoing support and everyone else who supported us during this situation. So after tonight, we're going to bury that situation and move forward and continue our progress in spreading kidney disease awareness across the country and globally. So tonight, I want to talk about patients' rights, responsibilities, and facility rules. Now, this gets skipped a lot because it's included in the admission package when a warrior is admitted to the dialysis unit. And so a lot of times, they want to get the person on dialysis, so they have you sign the papers and ask you to read them when you get home. And I mean, you put the papers away, but by the time you get home, excuse me, by the time you get home, you probably forget to read this and to know what's going on with your rights and responsibilities. So let's start off. Again, every patient, when they start dialysis, sign an admission package. And inside that admission package is patient's rights, responsibility, and facility rules. And, many companies may have it framed up different, but it's generally all the same. All facilities have to have this in their packet. So it's very important that if you still have your paperwork on your admission packet, look through there on the patient rights, responsibility, and facility rules. Very important. So your rights as a patient, as a warrior, when you start dialysis at an outpatient clinic, I don't care if it's Fresenius, DaVita, DCI, Liberty, whatever dialysis center, if you're overseas, it should be like this as well. Canada, wherever you are, you as a kidney warrior has rights. Now, these are a general guideline of the rights warriors have from a facility. As a warrior, dialysis center patient. So so basically, I want to have you fill in the blank when I say this. Whatever dialysis center pertains to you. So, as in, maybe you may go to DaVita Highlands or something like that. As a DaVita Highlands dialysis center patient, you are entitled. Okay, most of these um, packages, you got to look at the language, but a lot of this stuff is not happening. And a lot of you, I don't advocate this, but some of y'all, may experience stuff and have a lawsuit. You just got to go and read. This is your patient rights and responsibilities. It comes in your admission packet. So there's about 14 rights, generalized rights that um, are your rights as a kidney warrior. Okay, share this, because if you're a dialysis patient, kidney warrior, you need to know what your rights are at the dialysis facility. Seriously, and a lot of people miss out on this. They don't read the packet because there's so much information, and when you sign it, you just want to sign it, get your treatment, and go home. You don't go back, or people don't go back and look at the information, the whole packet. It's so thick. So I want to try to break it down so you can go back, look at it, think about some things. If any of this pertain to you or happen to you, you can identify with it. So let me start off with number one. As a kidney warrior, you are entitled the following. Number one, to be fully informed of your rights, responsibilities, and all governing conduct related rules governing conduct related to patient care and services. Okay. Number two, you're entitled to be fully informed of all services available in the facility. So whatever service in that facility, you're entitled to that, to be fully informed of it. Number three, to be fully informed of your medical condition and treatment plan from your physician. A lot of people don't think about that. To be fully informed of your medical condition and treatment plan by your physician. Number four, to know who your primary physician is and to participate with your primary physician in planning your care. Number five, this is an important one, to receive a full explanation of the nature of and necessity for recommended treatment appointments, including the risk and side effects and other treatment appointment options before giving consent to treatment appointments. A lot of people miss that. Number six, you have a right to refuse treatment/appointment to the extent permitted by law and to be informed of the medical consequences of refusing treatment or appointment. So you may have some warriors may call and say, I can't come to treatment. And as a nurse, it's our responsibility, ethical responsibility and duty just to inform you to say, look, if you miss a treatment, this can happen, this can happen. Watch this, watch that. Number 7, you're entitled to be fully informed of your suitability. Check this out. To be fully informed of your suitability for transplantation in all dialysis modalities. How many people start dialysis and they don't know anything else, any other treatment options? They never heard of PD. They never heard of nocturnal. They never heard of home dialysis. They never heard of anything else. But you are entitled to know that. You're entitled to. Number 8, you're entitled to be given the opportunity to participate in the planning of your medical treatment. So when the doctor's writing your orders, when the dietitian's talking to you, the social worker, you entitled to be included in that conversation. You entitled to it. This happens down around hospitals. The next one, you may see this around hospitals close to universities. Number 9, you're entitled to be advised of research studies which affect your care and give or refuse permission to participate in such research. So some patients around maybe like Johns Hopkins, I worked at clinics, DeVita Fresenius around Johns Hopkins, where they came in and did research on patients, drew their blood. I mean, of course they let the patients know, but excuse me, the patients didn't invest. Like, why are you doing this? What's the purpose? They just didn't care. Number 10, you're entitled to be fully informed of reasons for discharge or transfer from the facility and to be given advance notice unless the reason involves issue of immediate safety to other patients. So basically what that means is, which happens to some warriors, if you don't come to treatment as planned, if you miss 30 days, I believe here in Maryland, if you miss more than 30 days of dialysis treatment, a facility can discharge you from your dialysis from their clinic. But before, they have to help you find another place to dialyze. And also they had to give you warning. This has to come down with a contract. They had to let you know when you start missing like that, they give you some warnings and, hey, you miss it again, this is it. You can't get treatment here. So if a patient comes back after 31 days and they just walk in like they get ready to get dialyzed, we normally say we can't do it. They discharge you from the unit. Number 11, you're entitled to be treated with consideration and respect, including the need for reasonable privacy. Number 12, you're entitled to review your medical records. So you can look at your medical records. Don't let them tell you you can't. You're entitled to review your medical records with supervision by the director of nursing or one of their designees or designee, and at a time mutually agreed upon by both in advance. So you got to look at those type of language when they put it in there when you want to see your medical record, especially if you want to make sure stuff is getting done. Because I want to be honest, in a lot of your medical records, it's not a lot of stuff being written or should be put in there. So be vigilant. Number 13, you're entitled that your medical records and the information I just said that contained will be considered confidential. Number 14, you're entitled to freely express grievances. You're entitled to express grievances. If you see something you don't like, say something. They're telling you in this. So don't be afraid to say anything to the technicians or the nurses if you have a grievances or something you don't like or something that's been done against you that you don't think is right. You are entitled to freely express grievances verbally or in writing to unit staff, administration, the ESRD network organization. Each region has an ESRD network and appropriate regulatory agencies without fear of reprisal or discrimination. Let me say that again. You're entitled, if you're a warrior and you have a grievance or something that you don't like at your facility, you are entitled to freely express grievances verbally or in writing to unit staff, administration, the ESRD network organization, and appropriate regulatory agencies, state feds, without fear of reprisal or discrimination. So remember that. And if you're watching this and you know somebody that could use this information, let them know. Come back to this broadcast and see this, because it's important. This is very important to Reno warriors, that you know what's going on with your treatment and that everything is being done according to what you signed. Information regarding the grievance process will be provided to you. So they're giving to you the information in, when you take it home, they're giving it to you. So you already have it. Regarding the grievance process will be provided to you, and the facility social worker will assist you if you need it, if needed. Now, here's the other caveat to this package of patients' rights, responsibility, and facility rules. As kidney warriors, the company or the dialysis treatment facility expect you as a warrior or patient, as they say, to have certain responsibilities. Okay, now I'm going to read from this generalized rights. Well, it's from a facility. It's not a DaVita or Fresenius, but it's from a facility, a dialysis company, and everything is pretty much generalized across the board. Each company kind of tailored the information according to their facility. So, as a warrior, this is your responsibilities according to the company. As an blank center warrior, you have the following responsibilities to yourself, the facility, the staff, and your fellow patients. There may be consequences if you fail to fulfill these responsibilities, which can include, but are not limited to, physical side effects, loss of privileges, and temporary or permanent dismissal from the facility. blank center takes all threats of workplace violence very seriously and supports a workplace violence zero tolerance policy. Now, nowadays, a lot of companies are taking it seriously. Excuse me. Over in the UK, okay, about 2 years ago, there was a warrior. I guess, I don't know what the beef was with another warrior, but they were in the facility, okay, getting treatment. And they were laying, it was like a small renal unit, and maybe like 4 patients on each side of each other laying on tables. Well, not tables, but they were like these chairs, not recliners, but these kind of modernized chairs that they use over in Europe. But whatever beef this guy had, he got off the machine, had some type of liquid in this container in his bag. He was going through it. The other gentleman was on the other side getting his treatment, and the patient came over and had the liquid and took out his bag and threw it on the guy, and he poured out a lighter and he tried to throw it on him and it fell. Then he threw it, and then the whole place caught on fire. I think maybe like 2 or 3 people died, man. You can look this up, Google it on YouTube. Dialysis clinic burnt, or patient burned up dialysis facility in the UK. But it was crazy. So you never know. You never know someone's mental stability when it comes to dialysis. If they're dealing with other um, outside stresses that may just cause an impact and make them just want to do something like this, or even shoot up the place. You just never know now. So that's why you have to be right with God. I mean, you just have to have faith that whatever's destined, God already taking care of it. He's already taking care of it. So, but with that said, this is the responsibility. Acts or threats of violence by anyone on blank dialysis center premises will be not tolerated. Verbal, physical, or visual intimidation or harassment by anyone will not be tolerated. Violations of this policy may lead to loss of privileges and temporary or permanent dismissal from the facility. Everyone is responsible for immediately reporting acts or threats of violence, intimidation, or harassment. These reports should be given to the director of nursing or other blank dialysis center employees as appropriate, i.e., social worker, administrator. Possession of weapons or firearms at the blank dialysis center facility is absolutely prohibited. This policy does not apply to uniformed law enforcement personnel, whether on or off duty, who are required by law to carry their weapons while in uniform. Specific examples of conduct that may be considered threat or act of violence include, but are not limited to, the following: hitting or shoving an individual, threatening an individual or her family, friends, associates, or property with harm. I mean, I can't tell you how many times I've seen violence in the dialysis facility, whether it's cussing or let me share a story. This is a true story. I kid you not. Excuse me. I was working at a facility in Baltimore City one time. I was a charge nurse, and this was a 30-chair facility. A warrior came in, a lady. She was coming in to go to her chair, and she walked past another warrior that was sitting um, at the station. It was two chairs to the left of this lady when she walked in. There were two stations over to the left. So a warrior was in there on the phone talking to somebody and had a lollipop in her mouth. Mind you, she had mental illness, I believe schizophrenia, but she wasn't displaying none of that. But that was her history. So the lady walked in, was going to a chair. So she asked the other warrior who was sitting in the chair on the phone if she had another lollipop. The lady said, "No, I told you." Um, she said, "No, bitch, excuse my language. I told you I didn't have one." And the lady kept walking and said, "Your mother is a bee." I was like, "Uh-oh." And she walked around and she said that to the lady, and the lady looked. She was on the phone. She said, "What? Wait a minute." So the lady walked around, got on they put her on the machine. And I'm going to tell you, that lady was hot. I kid you not. She was on the phone and she was sitting at the station. She was looking over her shoulder because you can see over the counter to the warriors that was sitting on the machines on behind her. And so she was sitting on across against the wall on the machine, right? So she was on the phone and looking over like, okay, kept talking, right? So she told the technician, she got off the phone. She's like, I'm getting ready to get off the phone. So like I said, I was the charge nurse on this side. This is a 30-chair unit, and she was one of my warriors on that side. So I'm trying to de-escalate the situation. Look, please, this is not necessary. Get your treatment. She wasn't having it. She told the technician to take off. She had that right. She had that right to come off the machine. She took her off. She was holding her sights. She was talking to herself, right? Holding her sights, just waiting for it to stop bleeding. She was holding them. So, by this time, people, the technicians, we were just kind of slow walking, seeing what was going to happen, right? Because it's not funny, but I mean, you just had to be there to see. Everybody was kind of tense. It's a 30-chair unit, right? So she's holding it, and then it stopped bleeding. She taped it up herself. She got up. She walked around, and the lady was on the machine. Okay, I kid you not. She was on the machine. I can't think of the warrior's name. I'm gonna say Miss T. Miss T walked around and said, "What'd you say about my mother?" And she slapped her in the face. And when she hit her in the face, when she slapped her, everybody you heard everybody say, like they gasped. It wasn't funny at the time. I mean, now when you think back at it, it was funny. I mean, I can laugh, but at the time, it wasn't funny. She slapped her, and then the lady just held her face, right? Because she was an older lady. She was much older. She was a little older than the person who slapped her, Miss T. But she slapped her. Everybody like gasped at the same time. It was hilarious. And then she turned around and said, and that was with my left hand. I mean, and she walked around, got her bag, and walked out the unit. I kid you not. We had to transfer. They called the police. Baltimore City police came up. They went around, talked to her, and she happened. And the thing about it, she happened to be, you know, they rode together in the same cab coming to the dialysis facility. It was crazy. But that was just one of my stories. But let me tell you this one other story where this right here, I don't think it applies, and that's in prison. It's a story I can share with you. where I was working at Maryland Jessup Correction Facility doing dialysis, right? This was like a 5-6 chair unit inside the prison, inside the infirmary. And we was doing inmates. And so, I mean, it was crazy. These guys were in there, right? So it'd be one guy, he'd be controlling the remote control for the television. So it was this guy, he was a Hispanic guy. I can't think of his name, but he always bragged. And he would always bring these pictures with staff that come in, new people may work in there. He bring this picture of him. He would show it to us. Him, he was in Miami. It was an old picture. I kid you not. It was like a stack of money like this. It was a bundle on his table. So he was a drug dealer, but it was a bundle like that. I was like, in my mind, I was like, damn. But anyway, he was on the machine. And so an inmate normally comes in and pass out the lunches. So this guy came in, right? I kid you not. He said something to the guy on the machine and was like, that's why you're, MF on PC, mean protective custody, right? And the guy on the machine was like, I ain't on protective custody, and went back at him, said something to him, and the guy like pushed the cart down and was getting ready to grab the guy while he on the machine. And so I had to jump in between these guys. Mind that the guard was supposed to be at the door sitting down. Was he there? No. Man, I kid you not, I had to de-escalate this inmate inside this small confined, and the other inmates were in there. You had people on the machine with life, different charges. It was, I tell you, man, they paid me for being there, but that was just one experience that I went through that God just blessed me to experience, to be able to share with you that this is real. They do dialysis in prisons, they do them in nursing homes, and they do them in outpatient clinics. This is real. So specific examples of conduct that may be considered a threat or act of violence include, but are not limited to, the following: hitting or shoving an individual, threatening the individual, his or her family, friends, associates, or property with harm, the intentional destruction or threat of destruction of property, harassing or threatening phone calls, harassing or surveillance or stalking, the suggestion or intimidation that violence is appropriate. In addition, you are responsible for adhering to the rules of the facility. Failure, now check it out. You got to look at this language. Failure to adhere to these rules may result in the consequences listed above. And then they're going to say, you are to come for treatment, appointment as scheduled, and to arrive on time. You should notify the unit as soon as possible if unable to keep an appointment. Now, I'm just going to say, as a ex-charge nurse, and in my experience, I have witnessed warriors calling at the last minute, walking in when you're supposed to, treatment time is at 3 o'clock. They walk in at 5 o'clock. Um, I mean, come on, guys, that's really unacceptable. You got to really take charge of your treatment and not walk in uh, at the last minute and get only an hour of your treatment. I've seen warriors take themselves off after an hour or 2 hours. I mean, that's really unacceptable to yourself. Um, so, they expect you to come to treatment as scheduled. And I know things happen on the outside that may cause there be a delay to come there, but it's your responsibility to call and let them know that you're going to be late so they could, prepare for you to be late. Especially if you can't come or you're not going to keep your treatment, they set up the dialyzers and the equipment on the expectation that a person is coming for their treatment. And then it gets to a certain point when the person doesn't come, maybe for a week or 2 weeks, then they just don't set up until they see the white of their eyes coming in the door, because then they don't have to waste the equipment. And then the person's not going to get their whole treatment. Number two, you have submitted an advance medical directive. You are responsible for immediately notifying your attending physician, the director of nursing, or your social worker if you want to change your directive in any way. So, advance directive, basically, every warrior should sign one or needs to sign one. And that's basically saying if something, God forbid, happened to you while you're on dialysis, like a heart attack or something, and it renders you unconscious, or you go into cardiac arrest, do you want us to perform cardiac compression and breathing? Or do you don't want that? Or do you just want cardiac compressions and no breathing? Or do you just want breathing? So you got to make that very clear. If you're on dialysis right now, you need to know or check to know if you have advanced medical directive. Because again, if something happened to you, and something can happen, it may not, and I don't wish nothing. I ask God to praise all warriors, to bless them, that nothing happens, that they go through their treatment until they get their transplant or whatever God has planned for them. But if something does, you need to have an advanced medical directive. If you have a parent or loved one on dialysis, make sure you check that out. They see if they got an advanced medical directive. So if something happens, we need to know if we're going to do CPR or what we're going to do. You may not want that. You just may want, if something happens, you just may want to just go and transition. And that's okay if that's your decision. Number three, you have the responsibility to adhere to all aspects of your dialysis treatment appointment as prescribed by your physician. If you disagree with the prescription or desire that changes be made, now they're telling you that changes could be made. I'm telling you, you can control your treatment. A lot of warriors think they can't control their treatment. If you're watching this, this is pertinent information. I'm breaking it down. Let them know. It says, listen, you have the responsibility to adhere to all aspects of your dialysis treatment appointment as prescribed by your physician. If you disagree, okay, if you disagree with the prescription or desire that changes be made, you must discuss it with your attending physician or nephrologist. Your physician is the only one who can order these changes. It's telling you, you can disagree with if you don't want your blood pump at 500 or 450. If you disagree with that, tell your nephrologist, cut it down. If you don't disagree with 4 hours, tell your nephrologist, cut it down. A lot of people think they stuck. Listen, okay, I know we all put our faith in nephrologists because they've been to school, they had the medical training. I had training as a nurse, dialysis nurse. Okay, that's what they do. That's not their gift. Maybe some of that may be their gift, but that's a job to them. So they're thinking this right prescription is for you. That's what they're thinking based on your labs and their assumption, okay, that, hey, I'm going to write this prescription 3 hours, 4 hours, 4.5. I'm going to give you this size dialyzer. I'm going to put you on a dialysate flow rate of 800. I think these orders are going to be the best for you. That's what they're saying. But if you know and you mindful of your treatment, you're taking charge and know how much fluid you need to take off or how much blood thinner you need to have, or this dialyzer may be better for you, not that dialyzer. If you disagree with that, you have that right. It's telling you right here. Seriously. I mean, I just want to read it one more time so you know that you have this right. Again, you have the responsibility as a warrior to adhere to all aspects of your dialysis treatment / appointment as prescribed by your nephrologist. Okay, as prescribed by him or she, her. If you disagree, again, if you disagree with the prescription that he's writing or desire, you can look that word up, desire or desire. That means if that's what you want, if that's what you want. You see what I'm saying? So if you're on 4 hours, okay, and you think you should be running 3.5, if you desire to run 3.5 hours and you 4 hours, who is it to say because the doctor said he think you should run 4 hours, you think you should run 3.5 to 3? You know your body. You had that right. Now check this out. If you go 3 days a week, I'm not telling you to do this, but I'm asking you to just think of this logically based on your rights and responsibilities that comes in your mission package. If you run 3 days a week, that's the normal treatment, okay? 3 days a week, 3 hours, 3.5, 4, 4.5, 5. The doctor may come to you and say, we think you should do this 3 days a week, 4 hours of treatment. You do that and you cramp, you get sick, you nauseated, vomiting, you feel, because you know your body, that's you. You're inside your body, the spirit. Your spirit is experiencing the physical symptoms of dialysis, okay? If you know at 3.5 or 3 hours, or no, let's say this. If you're running 4 hours and you at 3.5 hours or 3 hours and 15 minutes, you up until 3 hours and 15 minutes, you feeling great. Everything you sitting back in, just chilling. The treatment is going well. And at 3.5 hours or 3 hours and 15 minutes, you start getting sick and feeling sick. And this happens every treatment, but you're running 4 hours and you desire to run 3, you can talk that over with your doctor and say, look, I'm running 3 hours or I'm coming 2 days a week. That's my desire. But on the flip side of that, if you're going to do that, you got to be mindful of your treatment. You got to look at your labs. You got to eat right. You got to eat clean. You got to be mindful. That's how you get in front of this disease. That's how you do it. You take control. If that's what you want to do, all they're saying is if you desire that changes be made, so changes be made. If you don't want to run 3 days a week and you want to run 2, hey, tell your physician you're running 2 days a week, 4 hours. If you want to run 1 day a week, 4 hours, tell them that. You have that right. Okay. So please share that, man. Seriously, share that with warriors wherever you are, to go back, look at your mission package, and look for the patient's rights, responsibilities, and facility rules. That's how it's framed up. You are responsible for treating other patients, visitors, and facility staff with consideration and respect. You have a responsibility to cooperate with the social worker and keep him or her updated with changes in your insurance. They want to get that money. Or financial status. They want to make sure they get their money. You're not getting money from somewhere else that they're not getting. Advanced medical directives and other changes in your family support system that may affect your health care. 7, you are considered an important part of your healthcare team and you are encouraged to participate in the planning process. But listen, how many facilities hold planning process? So how are you going to participate in something that they don't even do? Come on, how many people participated in a care plan process that's on dialysis? Come on. They're running short staff. They're running 3 shifts. Some places are running 4 shifts. They're just running like factories. When do you got time to have a planned meeting? Excuse me. We used to do that back in the 80s and the 90s, but once 2K came, that was a wrap. They just come to your chair. The doctor's supposed to be there, and the nurse, the dietitian, social worker, and they supposed to actually sit down and let you discuss it. They don't even do that no more. You have a responsibility to tell the staff if you have experienced any health problem between clinic visits, have seen a physician, or have been given new medicine and or had old medication changed. Yeah, we definitely need to know changes in medicine so we can update the medical records or the medication records. 9, during the time between clinic visits, you are responsible for following the directions from the healthcare team that are designed to prevent health problems. So let me read that again. During the time between clinic visits, you are responsible for following the directions from the healthcare team that are designed to prevent health problems. Now look, I got a problem with that one. What in case you got somebody new in dialysis 6 or 8 months, and you got somebody who work in dialysis, and then you have a new patient that's assigned to that person? And what in case that person give them some misinformation? Come on. I mean, we got to look at stuff like that. It's happening. New people giving out incorrect information to families and warriors. That's why you got to be mindful. You got your life in other people's hands. Also, you had a responsibility to comply with the blank dialysis center financial policies and are required to sign the assignment of benefits form so they can get their money, which include consent for release of medical information for insurers. So let me just tell you some of the facility rules. These are general rules that pertain to all facilities. Some may be, some may have them, some may not. But these rules include, but are not limited, okay, but are not limited to the items listed above. Facility rules. Number 1. Now this this is what I would be doing if I was admitting a new warrior at the clinic. I would be sitting down going over the whole mission packet. You know, we would try to get them in early so I can sit down and go over. So if you had any questions about this, I can answer them. But this doesn't happen during that process. This gets skipped. So these are the facility rules for most places. No weapons. alcohol, and I got a story about this. No weapons, alcohol, or illegal drugs of any type are allowed in a dialysis facility. Hey, this is now, it's funny now, but this wasn't funny at the time. The same unit that I worked at, where I explained the story that the warrior got off the machine and smacked the other warrior. Well, there in this same facility, there's a restroom inside the unit, and then there's one outside the unit. This was in a medical suite up on the fourth floor. I kid you not. This was downtown Baltimore. You had warriors getting off the machine in the middle of their treatment, going in the bathroom, shooting up, or smoking crack, either in the outside bathroom or the bathroom in there. They go in there, take a blast, and they come back out and get on the machine, or they get off the machine. I kid you not. They get off the machine. We tape them up. They go to the bathroom out in the outside the clinic in the hallway, and then go downstairs in the front and smoke a cigarette. I kid you not. I seen a warrior do that. I was going to breakfast one day, and he was outside. I said, and he had the lines, the needles taped up, right? And he was outside smoking a cigarette. And I was going out to go to the hospital to get something to eat. And I was like, I don't know his name. I was like, so man, what you doing now? You're supposed to be on the machine. He's like, man, I gotta have to come out here and get me a smoke, you know. So yeah, man, I'll tell you, I ain't gonna say I've seen it all, but I've seen some weird stuff. Number two, no smoking is allowed in the facility. At one time, back in the 70s, they used to smoke in the facilities. They had chairs that had ashtray holders in there. I kid you not. Some places, again, have this, some places don't, but this facility where I worked had this particular rule. Telephones, if available, must be shared among all warriors. Some places have cordless phones. And if you want to talk, they let pass it among the warriors. But let me tell you something. If you at a facility and y'all got a cordless phone and it's being passed around, please bring some handy wipes and wipe that phone off, okay? Seriously, wipe the phone off. Infection control. Some places may not even do it. But if you're at a place that do share a cordless phone, make sure you bring some sanitizer wipes and wipe the phone if you want to use it. Telephones, if available, must be shared among all warriors. Please be considerate and pass along the phone if requested after 5 minutes of use. Visitors are allowed in the treatment appointment area only by permission of the nurse in charge. Visitors will be offered use of appropriate PPE, which is personal protective equipment, normally a lab coat, as deemed necessary. Number 5, call a unit as soon as possible if you will be late or cannot come for your treatment/appointment. Um, Blank Dialysis Center is not responsible for loss of stolen items, articles. Now, a lot of places, even the place where I used to work, because I don't work there no more. So for those of you who may know me here in Baltimore from dialysis, let me just share this so you're hearing it from the horse's mouth. Today, I got a call that they didn't have any more hours for me, so you won't be seeing me anymore at Union Memorial Hospital. Right now, I call it I'm in suspended animation in my job, meaning I have nowhere to work, but I'm still employed, but I'm not. It's nowhere to work. But yeah, God got me covered. He got me covered. So number 5, call. Oh, I already said that one. Number 6, Blank Dialysis Center is not, oh, I said that one, not responsible for loss of stolen articles. A lot of places have Warriors leave hats, scarves, coats, but the place where I used to work has um, Warriors hanger where you can hang your coat and put your hat on top of whatever. And you see a lot of items left over. And a lot of places have that. And you would think that they would get a basket and have something like a lost and found instead of just leaving it up there. But I guess they think that, a person may remember, get it. But some people take it. You got some people that homeless or doing bad that still come to dialysis. Dialysis affects everyone. It affects everyone, black, white, rich, poor. It doesn't matter. And that's the one thing that warriors have in common is the disease. They may not have the money or our looks or our skin color or, fame, wealth, poor, whatever. But the one thing we do share, because I have kidney disease as well, is that, let me see. Oh, number 7, young children will not be allowed in the treatment appointment area except under special circumstances as determined by the charge nurse. Now, I worked at places where warriors had to bring their kids because they maybe were out of school or the school closed or whatever the case, and they had to sit out in the lobby while their loved ones are getting treatment. Now, what the case, the warriors' loved ones in the lobby, their children, if something happened while they're on the machine. See, this thing doesn't take any prisoners whatsoever. It affects families. It's just an awful thing, man. So that's why we have to stay in front and be mindful, and that's why I share this type of information so you know. So if you're a warrior and you have to take care of something, don't be embarrassed or intimidated to call a unit and say, "Look, I need to reschedule my treatment. I can't make it this day." And as I pointed out, if you desire to change your treatment time, you have that right. You have that right to do that by all means. That's what we mean by empowerment. Take control. You're supposed to know your treatment options. Some people go to dialysis and don't know about transplant, don't know about peritoneal, don't know about home dialysis. They don't know that they had that option. That's why we do these shows, so you know about it to take control. Um, I already pretty much talked about this, warriors' rules of conduct. The dialysis warrior is expected to keep appointments as scheduled and is responsible for notifying the dialysis of any changes in the regular schedule, like emergency hospitalizations. Yeah, let me share this. Seriously, if you're a warrior, dialysis warrior, wherever you're at in the United States, overseas, if you wake up in the morning and you're sick, you're vomiting, you have a high fever or temperature, or if you feel your access is not working, don't go to the dialysis clinic. Go to the emergency room, because going to the dialysis center will be a waste. Because if you're as sick to the point where you feel you need to go to the emergency room, go there, because that's where they're going to send you when you go there. And that's just a waste of time and energy. Okay. And then also, if you're a warrior and you're about to be discharged from the hospital, call a dialysis center and let them know you're getting ready to be discharged, you're getting out. Because if you get out and you show up, they may not be ready for you. They may not have space available. I've seen that happen many times. So please be mindful of those two things. If you're sick and you feel like that you're sick enough to go to the emergency room, go to the emergency room, not the dialysis facility. And um, if um, if you feel like that you're not going to, come in, if you being discharged from the hospital, And if you know your number, just make sure you or a family member call to let the clinic know that you're being discharged. And also bring your discharge papers with you, the discharge summary from the hospital, so we know what so they would know what new medications that you're on, or any antibiotics. Okay, I already pretty much went over that. And then I want to go over the main important, oh, this is a lot. Okay, let me go over this right quick. This is the Warriors quote quote disciplinary action. This most companies had that disciplinary action inside that packet. Uh, so here it goes. In order to deliver quality treatment as agreed when consenting to treatment, warriors must be ready at the scheduled time, be courteous to other warriors and staff, and comply with diet and prescribed medication regimen. Examples of a non this is the term that they use. Examples of a non-compliant warrior are a warrior who, one, does not adhere to treatment schedule, two, has failed to adhere to warrior responsibilities and rules of conduct as stated and agreed upon. Now, this is the procedure for a general procedure normally for warrior disciplinary action. Number one, first incident. Charge nurse will talk to warrior and remind warrior of his or her responsibilities and rules of conduct. The incident will be documented in multidisciplinary notes. How many times has that happened? How many times have y'all seen other warriors fly off the handle and cussing people out and leaving out of the unit, and people looking there disbelief? I just gave you examples of a warrior slapping another warrior, and you know that. So number two, second incident. Warrior will meet with director of nursing or administrator and social worker of dialysis unit, and they will set conduct guidelines. So you got to fall into those guidelines when you meet with them for the second incident. Incident and meeting will be documented in multidisciplinary notes. Third incident. A meeting will be set with administrator, director of nursing, physician, social. Now they bringing in the physician or the nephrologist, social worker, and the warrior. At this time, a contract will be developed with behavioral recommendations from all members of disciplinary team and will be signed by all persons present at the meeting. And then it goes on to say, if behavior continues after meeting, the administrator will be notified. The administrator will notify the physician to make arrangements. Listen to that. The administrator will notify the physician or nephrologist to make arrangements for the warrior to be transferred to another facility. The social worker will assist the warrior in selecting a dialysis unit and will help with discharge and transfer arrangements. Now, let's get to the good part. Now, what I mean by the good part, what I mean by the good part is they said what they expect from you. And I also went over what you expect or what they are expected to give you your rights. I mean, to your let me get that form. Your rights as a patient, as a warrior. That's what they said. Now, if any of those are not being done, this is where you come in to file a warrior's or patient grievance. Most all places has a process for this. It's called the patient grievance process policy, and this, as well as the uh, um, patients' rights, warriors' rights, responsibilities, and facility rules are located in the dialysis unit lobby. It has it's state regs that if it's not in the lobby, it's in the facility, but normally it's in the lobby so you can read it. A lot of people just come in and sit in the chair, wait to go on dialysis in the lobby and don't even read what's on the wall, their rights and responsibilities. And some people complain that they want to do something. That grievance procedure process is right there on the wall with the phone numbers. So this is the purpose, to provide for prompt and equitable resolution of complaints or issues affecting potential or current warriors or patients at blank dialysis center. The policy, number one, an appropriate grievance is defined. Now check this language out. An appropriate grievance is defined as a current or potential, okay, potential patient's expressed feeling of dissatisfaction concerning any interpretation or application of an admission or treatment related policy by the staff of blank dialysis facility center. Dissatisfaction with any policy may be presented under this process. The grievance process has 3 steps which may be pursued. However, any one or more issues may be resolved at any step in the process. Blank Dialysis Center does not discriminate in the admission of, access to, or treatment in their clinic programs and activities with regard to national origin, race, age, sex, religion, income, disability, or other factors unrelated to the provision of appropriate medical care. Warriors using this procedure to address issues will not be penalized for use of the grievance procedure. 3, the use of this procedure is not a requirement to the filing of a complaint with the Department of Health and Human Services, the End-Stage Renal Disease Network Organization, or other appropriate state or federal agencies. 4, a copy of this policy and procedure will be given to all warriors upon admission. So you have this, they said it, will be given to all warriors upon admission as a part of the new warrior information package. 5, copies of any grievance filed by warriors will be maintained in the file in the facility and retained for the same time period as the medical record. 6, this policy and procedure will be posted So it is clearly visible to the warrior and families. Like I said, this is in the lobby of your facility. Posting of network or other grievance procedures will be done per local, state, or regional requirements. All warriors, including potential transient warriors, may use this process. So this is normally, as you can see, the warriors, or as I call it, patient grievance procedure. Now that's a general procedure throughout all facilities, not just this one, but all facilities. Now I'm not sure how they do it in Canada and Europe and over in Asia countries. I can't answer for that. I only can answer for here in the United States and in Baltimore, Maryland, or the state of Maryland. So let's go on and start. The warrior patient grievance procedure. Current or potential warriors who feel they have an appropriate grievance should contact any regulatory agency listed below or proceed as follows. If you need help in initiating the grievance process, the facility social worker is available for assistance if you desire. Number one, detailed. So now let me just explain this. What I'm about to read, this is the process that they want you to go through. This is how it's like a chain of command. But you don't have to go through the chain of command. You could bypass the chain of command and go straight to the regulatory agency in your state. Okay? I don't care what state you're in, dialysis facilities are regulated by a state regulator, and that comes in expected clinics. And if you have a legitimate complaint or grievance about your treatment, about the facility, people not washing their hands, short of staff, just crazy stuff, you have that right to report it. So this is how they want you to do it. But I'm about to say, you can go through this process. A lot of times it may get resolved at the unit. Sometimes you may just have to go straight to the regulatory agency, man. Seriously. Because what you're going to do if that unit doesn't have an administrator? How's it going to get passed? Because you got to go, that chain of command involves the administrator. If you have a facility that doesn't have an administrator or a charge nurse or different people coming in and out, how you who are you going to complain to? I mean, it's ridiculous. But this, you have to know this, because if you know this, thanks Ed, thanks. If you know this, you can be armed. You could be armed because you already have the information in your packet. You already had it unless you threw it away. If you threw it away, go back and see if you can get a copy of Patients' Rights and Responsibilities. But a lot of people throw this stuff away, and they got stuff where something happened, you need to go to court. You can look through your packet and see what was your what their responsibility was. And if they didn't have to that, you may have a suit for negligence. A lot of people don't see that, especially when they cannulating your arm with these needles, with these new people. If they messing up your arm, that's negligence. Especially if you got a new person, 3 months, 4 months, fresh out of class, they sticking you, they poking you, digging down with those needles. Come on, that's ridiculous. So look, this is how they want y'all. This is how they want warriors to do it. They want you to detail the grievance in writing if possible, or if not, present it verbally to the director of nursing. Keep a copy of the grievance as presented to the director of nursing if possible. If the grievance involves the director of nursing, then the current or potential patient may proceed immediately to step 2. The director of nursing will investigate the grievance, attempt to resolve it, and communicate a decision to the current or potential patient warrior in writing within 10 working days. Some places may have different uh, uh, days that they may, notify you in writing. The director of nursing or the administrator will prepare a written and dated summary of the grievance and proposed attempts by the director of nursing to resolve the matter. That normally don't happen, man. I'm telling you. So number 2, if the warrior is not satisfied with the decision given by the director of nursing, then the warrior should forward the written decision from the director of nursing and a copy of the original grievance to the administrator. So if you're not happy with the director of nursing, go to the administrator. What if there's no administrator? Then go to the other administrator who may be covering. To the administrator, along with a request to have the decisions reviewed. Look at all this stuff that they're taking you through if you have a complaint that needs immediate attention. That's why I recommend going straight to the agency. The warrior may also request a personal meeting with the administrator instead of submitting written materials. The administrator will confer with the patient, warrior, the director of nursing, and any other appropriate individuals, investigate the issues, and communicate a decision in writing to all involved parties. This one says within 15 working days of receipt. I just almost want to laugh at this when I read it because this, yeah, man, you know that, man. You know that, Ed. I mean, come on. I mean, but some places I believe do really try to adhere to this. Um, some places do try to adhere to this, but normally it doesn't go this way. That's why you got to go straight to the agency because all this, political mumbo jumbo, process and bureaucracy, paperwork, meeting reviews, and all that, and you got something pressing. You can't wait 15 days for someone to get back with you. That's 2 weeks. If the warrior is still not satisfied, the decision may then be appealed to the medical director by submitting all documents and the desire to appeal the decision to the medical director. The medical director will take the necessary steps. Now, these doctors not in like that, man. They going to other facilities, seeing other warriors, 5, 6, 7 facilities in a day. When are they going to have time to look at this? Come on. Um, okay, the medical director will take the necessary steps to review. He said he will take the necessary steps. What's necessary? To review and investigate the grievance and will then issue a written final decision within 15 days. So that's a month. God, dog. That's a month. In writing to all involved parties within 15 working days of receipt. I'm sorry, within 15 working days. Final decisions on grievances will not be precedent setting or binding on future grievances unless they specifically state they are being adopted as a company policy. Or number 4, they give you the last choice. You may submit your grievance to the appropriate appropriate regulatory agencies. So on here, they had the Mid-Atlantic Renal Coalition, which is located in Richmond, Virginia. Even though we're here in Baltimore, I think there are 5 networks located throughout the United States. And I'm sorry, I'm not sure. It could be 5 or 7. I'm not exactly sure, but I know here in Maryland we're in Network 5, and uh, they're located in Richmond. And so, or you can call here in Baltimore the other state. I'm sorry, the other regulatory agency, which Maryland units call is the Maryland Office of Health Care and Quality, located in Catonsville, Maryland. So that's about it. I know it's late. I thank all who's still on watching. Ed, thank you, man, for staying faithful to the end. Please share this. Um, just share this information. Let people know that they have rights and responsibilities when it comes to dialysis. They hold it right there in their admission package. So all you had to do is go back and look at it. You'll see it for yourself. Till what's today? Friday till Sunday. It's Sunday morning transplant coffee talk. We're gonna have Rosemary Atanga. Till then, I see you. Thanks, Ed, for tuning in. God bless you, brother. Peace and blessings.